Is laughing gas a laughable matter? Do we use it to entertain your child? Do we use it for you to relax? What do we use laughing gas for in dental office? I'm Dr. Olga Dolgier, board-certified pediatric dentist here at Palm Valley Pediatric Dentistry and Orthodontics. One of the most common procedures in pediatric dentistry is fillings and stainless steel crowns, and we use laughing gas every single day. We use it on many different kids, and many different behaviors, many different procedures, and it's very, very common. Sometimes parents are a little bit concerned about laughing gas and they're not sure if should we use it or not. They don't feel easy about that. So let's dig in. Let's find out what laughing gas is. Is it a laughing matter or not? So laughing gas is nitrous oxide. Has been used for many, many years. It actually was first started to use for entertainment in last century. The percentage of laughing gas being used for entertainment was very high. So people actually didn't have enough oxygen. So they had hallucination, they had very interesting effect. They were laughing their head off because it interfering with GABA receptors in your brain and opioid receptors. So they were getting kind of interesting sensation, visions with the laughing gas. Nowadays, it's completely different. Your kid will not ever have a really high percentage of nitrous in the system because our digital admission of laughing gas does not allow us to go above a certain percentage. So it's always within the safety range. It never exceeds that range when it can affect oxygenation of the brain. So how does laughing gas works? So as I mentioned before, it actually binds to a certain receptors, we call them GABA receptors in your brain, and makes anxiolytic effect. It means that it decreases your anxiety, makes you feel more relaxed, happy, and it does not dissolve and bonds to your red cells in blood, which is good because as soon as we turn nitrous laughing gas off, we put you at 100% oxygen, and within 5 minutes there is no more laughing gas in the system of a child. So you came in and you're leaving the same as you came in the office. There is no lasting effect. So why we use laughing gas? What are the indications and why and we should never use laughing gas, and who are the patients with contraindications? So the kids who need laughing gas usually my cooperative kids but anxious child. So for example, I have a 5-year-old. I just had a kid this morning. Anxious, had some discomfort, some pain. Cooperative, you can talk to him, he listens to you, but just kind of scared. So laughing gas and TV on the ceiling, great combination. So laughing gas makes his body feel tingly, makes him more relaxed. He didn't even feel that we had to inject him and numb the mouth. He was comfortable. And I can regulate nitrous. I can use it higher. For example, for injection, I put my nitrous laughing gas to 50%. 50% is nitrous and 50% is oxygen. When we working percentage is usually 30 to 40%. It's very common. So 70% oxygen, 30% laughing gas. And it gives us enough time to finish that short appointment, usually half an hour, 45 minutes, no more than that. And then we turn the nitrous off and child go home. So what are the indications? As I said, anxiety, gag reflex. Some kids, they have very strong gag reflex, and nitrous diminish that gag reflex. What kids should be able to do if you use laughing gas? Number one, they should be able to breathe through the nose. If they have congested nose, they obviously cannot breathe through the nose. Laughing gas doesn't work. If the kid is crying and it cannot control his emotions, cannot stop crying. You remember the tears go through your tear ducts and also go through your nose. They open up in the nose. So stuffy nose and cry, contraindications, because kid cannot actually accept the nitrous food and cannot actually breathe in. Sometimes the kids start crying, we put nitrous laughing gas all over the mouth, they breathe it with the mouth, and then we transfer to the nose when nose is no longer stuffy. So it's kind of, we play around with it. What are the contraindications for laughing gas use? If your child has COPD, congestive lung failures, when we have severe lung problems, you would definitely know that, then we should not use laughing gas. Number two, if your child has eye disease, glaucoma, we should not use laughing gas. If your child was diagnosed with MTHFR mutation, which is very common mutation, but you have to have 4 or 2 alleles of this mutation in order to have true contraindications for laughing gas. Why? Because if your child has that mutation, they do not metabolize B12 well. They can be B12, it's a vitamin, and they can have B12 anemia because of that. So nitrous would kind of make it worse. So what we want to do for kids with certain type of mutations, like MTHFR, for example, if they do have true mutation diagnosed, we would not use laughing gas. If they only have 1 or 2 mutations of 4, then we still can use laughing gas, and we usually advise to pre-medicate child with B12. So you can start B12 regimen. You actually sometimes send you back to physician, check the levels of B12, making sure your child is safe, and then we can proceed with nitrous or laughing gas. MTHFR mutation has a lot of controversy around it. Some providers do not recognize it as a true mutation and do not recognize as any obstacles. But as far as what we are concerned in dentistry, it does interfere, it increases your homocysteine level, also can affect B12 levels, so we're very careful with MTHFR mutation and laughing gas use. What else are contraindications? If your child had an ear infection and it's less than 14 days from the last time he had that ear pain, then I would not recommend laughing gas as well, because when they're breathing through the hood, it changes pressure in the ear, and the ear can start hurting again, or it would be hurting during the procedure, which does not help us. We want your kid to be comfortable. So ear pain or acute ear infection, or your child just recovering from upper respiratory tract infection, those are as well contraindications for laughing gas use. So if your kid has one of those conditions, on at least talk to your dentist and see if he is a good candidate for laughing gas at the time of the appointment. B12 is actually more important for me than for you guys, because I have professional exposure to nitrous, and we actually did the testing. We had the badges on our scrubs to check what nitrous percent we're getting, and it was very low, so we don't have very high exposure, and we periodically check B12 level, and we don't have deficiency. So nitrous overall is a very, very safe tool we use to decrease anxiety in children. So laughing gas has this little hood, this little nose. It has different flavors. So this is a bigger size. If you have older child, it kind of covers your nose. Like this, they're disposable, but they smell really good. This one is bubble gum flavor. This one is a smaller size and goes on younger kids' nose, and it has orange flavor. Laughing gas by itself does have sweet smell to it, so combination of flavored nose and sweet smell is actually very helpful. So tell me about your experience with laughing gas. Are you concerned that your child will have nitrous used for dental treatment? Share with me and let me know how can I answer all your questions. Thank you so much for watching, and have a nice day.